Hi, I'm Amanda Diamond.
And I'm Jared Karen, and today we're going to show you how to use the triage form.
So we are going to use the global quick text .triage. This can be typed into any update, and you can see we are here in a phone note, and it automatically populates the form.
Oh, that's cool. But wait a minute. We have the form in front of us, but I don't see any buttons.
Well, Jared, what you're going to want to do is click the Now button when you talk to the patient, and it opens up the rest of the form.
Hey, look at that. Look at all those buttons
Yeah, it's pretty cool.
and fields.
Pretty cool.
But wait a minute. So, like, I'm in the form, and I'm talking to the patient. What if I have to go find information in their chart?
You actually won't need to leave the form because all the information you need is right at your fingertips. So if you look up here, you can see the problems list is right here. You have the past medical history, family history, social history, all right there. Move down a little bit, you get the patient's medication list, allergy list, so you can review all that right there.
Oh, so it's right there. I can just click on those buttons and see what I need to see.
So if you jump a few tabs to the disposition tab, you also have the immediate care guidelines right there at your fingertips. So if you're not sure to disposition the patient to immediate care or not, you can review these right here within the form. You also have their information, so their contact information, the address, the phone number, hours, and so forth to all the immediate cares and the lab locations, so it's pretty neat.
Oh, that's cool. That's so much faster than looking it up.
Yeah, there's also some resources there on your bottom right if you are looking for some phone numbers, for example, to like poison control and so forth.
Oh, that's cool. So here's my thing, Amanda. I've been looking at this form and I'm a little concerned because there's a lot of boxes and a lot of buttons. Do I have to put information in every box and click all the buttons?
I do realize that. There is lots of boxes, but not all boxes need to be filled. This is just reminders for you to ask the patient certain questions based off of the situation.
Okay, so like let's say this first tab, if I'm in here, can I just type a note in this box?
Absolutely. So if you're someone who writes a narrative note, you just do that right there.
Oh, like that. Okay, so I can just type my note like I would normally do.
Exactly.
But I've seen this tab, this ROS tab with these buttons where you click on the symptoms and they show up. Do I have to do that if I wrote my note in the other box?
You do not. So you want to do one or the other because otherwise you'd be double documenting. And I just want to point out too that this ROS tab, which is Review of Systems tab, also has little boxes at the bottom. So if there's additional information that you need to add, you just do it right there.
So that's interesting. But what about this other like disposition tab? Are there like, do I have to use the boxes and drop downs here?
Again, you don't need to fill in all the boxes, but we do say to fill in the disposition tab. That does coincide with the protocol book. So it's actually going to be pretty easy to do that as well anyway. But also if you gave the patient any other additional information, you can free type that here. And when you tell your patient to call back for persistent, changing, or worsening symptoms, you can click this checkbox to document that in one click. The protocol drop-down, we do say that you should do this absolutely because you should be using a protocol book when triaging.
And that's going to have the current additions?
That's the most updated information, yep.
Oh, that's cool. Do I have to put the page number?
You can, or you can do the title of the protocol, and you would just free type it in, just like that.
Okay, but I should fill out that box?
You should, yeah.
Okay.
Also, when you hang up the phone with the patient, you would want to click the Now button because that timestamps it.
So I want to click that when I'm done talking to the patient, not when I'm done writing my note.
Exactly. Yeah. When you hang up the phone with the patient, you want to jump right to that tab and click that Now button because that ends the call.
Okay. So I see we have a timestamp when we started talking and a timestamp when the call's over.
Exactly.
That's cool.
Yep.
All right. So there's one tab we haven't talked about yet, and that's this thing here, this provider review. What's that for and when would I use it?
So if you have a question to the provider, whether you be an MA, LPN, RN, doesn't matter. If you have a question for the provider, this is where you would free type that. And then you would just click signature.
Okay. That's pretty cool because I see it has this nice bold heading and then they'll know that I need their help.
Exactly. So those fields help throughout the whole form actually do help organize your note and just make it look nice and clean.
Huh, that's cool. All right, well, this is a little less intimidating than I thought. I was a little overwhelmed by a lot of the boxes and buttons and things, but it seems like it's kind of like a toolbox. I can pick and choose what I want to use and use it to kind of make my note a little bit tighter and more organized.
Right. You don't need to use all the tools in the toolbox, but they are there for you. Absolutely.
Sweet. Thanks, Amanda.
You're welcome.